Want to know about Ozempic and what Ozempic does to your face? Hey, I'm Dr. Raghu Athre. I'm a double board certified facial plastic surgeon in Houston, Texas. I'm also the inventor of the 4D facelift. This video is about Ozempic. Ozempic, semaglutide, all these medications are one of the hottest medications, especially in the last couple of years. It almost sounded too good to be true. You can lose weight, just take a pill? Yeah, that's exactly what it was. So this video is dedicated to what are some of the downstream effects of Ozempic? Where did it start off? What's it used for? All of these little questions that I'm sure you're wanting to know. And it'll also use some words that you've probably seen hashtagged like Ozempic face. What is it? So let's just dive right in and figure out what Ozempic is, what it does, and how it works. So Ozempic is a medication that was originally designed for diabetes. Now let's talk a little bit more about this. There is something called metabolic syndrome. So metabolic syndrome is a medical term, and it starts off with patients that sometimes start gaining weight. And as they gain weight, one of the things that can happen is that the control systems in the body to maintain their sugar levels kinds of gets out of whack. On a very severe level, this ends up being diabetes. So it's kind of a spectrum, starting off with weight gain, sugar balance gets a little out of whack, continue down the road till frank diabetes. Now, as this process happens, one of the things that occurs is it becomes harder to lose weight, it becomes harder to manage the sugar, and it becomes kind of a vicious cycle. So a bunch of people got together and said, hey, listen, if we can kind of target this at the beginning end of this metabolic syndrome, patients are going to live longer, they're going to have less heart problems, kidney problems, all of these various things. Voila, semaglutide. So semaglutide by itself is actually a great medication. It's done a lot of different things. It allows patients to lose weight, manage their sugar, and many of these patients, after they've lost some of the weight, their sugar values have come back down to normal, to the fact that they may or may not even need medication to manage their sugar values. Sounds pretty amazing. You get to lose weight, manage your sugar, all with a pill or an injection, but here's the downside. So I think that Ozempic is a good medication. I think it definitely has a place in the weight loss, weight management, diabetes management industry. However, when you look at these patients who have been on Ozempic for long term, they are starting to have some issues with severe fat loss in their face, in their bodies, in other portions of their trunk. How does that kind of look like? So when you look at your skin or your face, you've got different layers to it. So you've got your skin, and underneath that there's a very thin layer of fat. Then there's the muscle layer, and then there's stuff underneath, which is important, like glands and muscles and things like that. In this area right in here, again, you have skin. Underneath the skin, you've got a little thin layer of fat, and then you've got the muscle, and then there's some fat underneath that as well. And then you have glands and nerves and important stuff. What Ozempic is doing is that thin layer of subcutaneous fat sometimes is being basically eaten away. As that happens and patients lose volume, stuff hangs, okay? First of all, if it was a patient who was morbidly obese or really had a lot of weight on, they may go, listen, my health is so improved, I really don't care too much about the cosmetic aspects of that. But what about those patients who really weren't morbidly obese, but wanted to lose a few pounds, they took the Ozempic, and now if you look at their face, they're actually looking worse than what they started off before. And they look worse because they've lost a lot of the volume. Now, this isn't something that I can just add volume to them and fix the problem. These patients really require surgery in order to lift these tissues. As I've operated on these patients, I've noticed a couple of things. The fact that they've lost the fat or that volume in such a rapid fashion with the medications, what's happened is that skin has lost its elasticity. So I can lift them, I can redrape the skin, but the skin's ability to actually hold up in its higher position is a little less. So these are some of the things that happen to patients when they're taking Ozempic. So there's a lot of controversy about if these things are happening. Should we use Ozempic? Should we not use Ozempic? And I think the jury's still out a little bit on this, but I think there's some very simple baseline rules to this. Number one, we need to think about what was Ozempic's true original purpose. Its true purpose was to reduce the number of people who have diabetes, help these people out by losing weight, getting them off diabetes medications, able to manage their blood sugars. The goal, if you could do that, was that these patients would live longer with less problems long term. And I think Ozempic is great for those reasons. Now, when we take Ozempic and say, hey, because it works in this group, let's go ahead and give it to somebody who's 20 pounds overweight or 25 pounds overweight who just doesn't want to work out or who doesn't want to change their nutrition plan. All these different types of things, you're going to have a lot more of the complication side and not so much of the health benefit side. So that's one main thing that I see on the seesaw of whether Ozempic is good or not. There's also some long-term considerations for patients as they're on Ozempic. So we've talked about some of the cosmetic long-term considerations in terms of Ozempic face, and I think some patients are seeing this. They call it Ozempic butt, where they lose some of the volume in their butt. And there's also women who have Ozempic boobs, where some of the breast volume is reduced and the boobs become saggier. So it's not just in the face, it happens over the entire body. But from a long-term perspective, the weight management portion of things, Ozempic is really a medication that is a stepping stone to long-term life modification. In every study that we have seen, okay, whether it is for bariatric surgery, stomach bypass, gastric stapling, every single thing, what we've long-term seen is that patients do best when they use these things as a tool to modify their life, meaning better nutrition, better eating habits, better exercise habits. So if you use it as a tool short term and modify your life to have these better habits, you do better long term. Now, on the other hand, if you use it as a crutch and not really do the long-term modification, the long-term effects really don't stand up. And this is true for whether it's Ozempic or whether it's stomach stapling or gastric bypass surgery. So the take-home point I think that I have in all of this is, 1, Ozempic's a good medication. 2, if you are morbidly obese or you have a lot of weight on and or you have diabetes and or pre-diabetes and or you have sugar management issues, I think that the possible benefits of Ozempic far outweigh any of the other stuff, because we got to take care of you as a patient first. We need to make sure that long term you don't have kidney problems, you don't have high blood pressure, heart attack, all that kind of stuff. Now, beware that as you do this, there may be some cosmetic complications or cosmetic effects, I should say, that may need to be addressed if you so desire. On the other hand, there is this other group of patients where you've got patients who may be 20 pounds overweight, 25 pounds overweight, and they just want to pop a pill. I see this every single day as I'm driving down on the freeways. You see ads come in and it's semaglutide injection for da-da-da-da-da. This uncontrolled just giving out semaglutide for short-term crutch type of thing, I think is going to hurt patients long term, especially from a cosmetic standpoint as well. And the double whammy is the rapid loss of weight makes it actually harder to really do a procedure and get great results. So if you're in this cycle of thinking about whether I should go ahead and just jump on Ozempic, I hope you listen to this video. I hope you kind of take all of this data and figure out where along the spectrum you fit in for yourself. Whether you're on the major weight loss thing or the minor weight loss, please remember, long-term results are really based on lifestyle modification, diet modification, all these things, and there are resources to help you, okay? So if it's used for its proper purposes, I think Ozempic is a great medication. I really hope this video has kind of opened your eyes to Ozempic, kind of with a non-biased view of whether it's good or bad, and giving you some of the pros and cons of Ozempic. So if you find this content helpful, if you go, hey, I like this, Give us a thumbs up, subscribe. We'll keep you alert of new content. If you've got ideas or questions or, hey, I want to know more, please send us questions, comment, DM us, however you want to get a hold of us. We like teaching. I like throwing some of my opinions out there, and I like being able to give patients options and rational thought processes to what I believe. So I appreciate you watching this video. Dr. Raghu Athre, ATHRÉ Facial Plastics, Houston, Texas.